originally from South Jersey. My family is originally from Cape May County. I moved to Philadelphia for my medical training, went to med school there, did my residency there, and initially was working in Philadelphia. I still live there actually and commute to my job currently in Pennsville. And through my different experiences, going through medical school, going through residency, and through my training, I realized that something that was really important to me was building connections with patients and building continuity. And building those relationships with patients was something that I really looked forward to in establishing in my healthcare. I think one of the things that was interesting about coming to Pennsville for me was knowing that there is a community that had a need for primary care there. And even from younger populations or people trying to establish good preventative care, which is so important in what we do in primary care in general. And I think that's something that I look forward to trying to establish in that community, is somewhere where people feel like they can come and be heard and be understood. I think for everybody, it's important to establish what people want out of their own healthcare and what they're looking for with a provider. I think establishing a relationship and getting to know the whole patient as a person, their backgrounds, whether it's their family relationships, their work relationships, and so many other things about our life that we typically don't get to express in those short visits in 15 minutes is something that we can get to know over time and gives me as a provider a bigger picture of people's healthcare and what motivates them in trying to get healthier and what they want out of their health. My philosophy of care is very much a team-based approach. Patients want to come to providers and to know that they get to be part of the decision-making process. Something I do a lot in visits is try to slow down and make sure that are we on the same page, and if I feel like things are not, a lot of times it's helpful to reassess and be like, do you understand why I'm saying what I'm thinking or why I'm making this decision or making this suggestion for a patient? What inspires me most about being a physician is helping people get the most out of their health, being able to understand what a patient expects and what a patient's desiring in their own lives, whether that's making things even better than they already are or addressing issues that concern them. If you have gotten to know me and establish a relationship with me, I think that's a very fulfilling part of medicine, to know that I can meet you in those places.